My name is Carolyn Dudley, and this is the School of Public Policy. Today, Herb Emery and I were pleased to release a report on the costs of autism. Specifically, we looked at the staggering costs that families face when they have a child with autism. To determine what the costs were, we profiled 3 different individuals on the autism spectrum: a lower functioning person, moderate, and a high functioning person. Reviewing the research that was available and working with community groups, we estimated what types of support those persons would need. And then, using a forensic economic approach, we placed a value on the time needed to provide those supports and came up with a final number. The final numbers even surprised us. A family with an individual newly diagnosed with a child of autism would have to invest $1.6 million at the age of diagnosis, which is typically age 2, to pay for the lifelong care and support that individual will need above a neurotypical child. So these costs would cover only the value of caregiving time. So for an individual who's, say, a lower functioning individual, constant vigilance because they are unaware of danger, needs for support during bathing and brushing your teeth, or for higher individuals, higher functioning individuals, the need for social communication supports, or the assistance with executive functioning types of needs like planning and coordinating. And these are needs above and beyond the other healthcare costs often associated with autism, like added speech therapists, psychologists, or communication devices like iPads or sensory equipment. Governments across Canada do provide some funding, but into adulthood, the funding for adults over the age of 18 does level off. And some of the gaps are the infrastructure that's available to support the family in terms of quality housing supports, for example, even things like available long-term respite care, employment supports, or even quality and available day programs for individuals living with autism. Now, of course, we know that many families do not have $1.6 million to invest, and so we are proposing a number of options that governments can consider in order to fill the gaps. So some of the policy measures that governments could consider relate firstly to housing. So looking again at models that provide more shared services for larger numbers of people, more than 2 or 3, in a setting that's more of a quality of life setting, so maybe they have access to employment supports, recreation, shared transportation, and also integration into the community. And secondly, considering creative options. For example, in the province of Quebec in Canada, they are using autonomy insurance, and this would be a plan that would be similar to almost a birth insurance or pension planning, where all people would pay into a plan, and then if you needed lifelong support, either you're a senior in need or you have a child with a lifelong developmental disability, your care, long-term care, would be covered. As the prevalence of autism continues to grow, we know that this is an issue that crosses all borders, and governments worldwide will need to seriously consider policy options that support individuals and their families. I encourage you to read the paper for yourself. You can find it at policyschool.ca and click on Publications. I'm Carolyn Dudley. This is the School of Public Policy. Thank you for watching.